Good evening, everyone. Thank you for joining us for our final MSF 2020 Recruitment Information Evening. As MSF, I would like to acknowledge the Gadigal people of the Eora Nation as the traditional custodians of the lands upon which we meet this evening. This land always was and always will be Aboriginal land. We'd like to pay our respects to their elders, both past, present and future, for they hold the memories, the traditions, the culture and the hopes of Aboriginal and Torres Strait peoples of Australia. I'd also like to recognise that Australia is a binational association, and I would like to take this opportunity to salute our colleagues from Aotearoa, New Zealand. My name is Margaret Bell and I have the great pleasure of being your host this evening. I am a nurse and a midwife and a field worker, return field worker. I have done 5 placements with MSF over the years. My first was in 2003, sorry. Since 2013, I have been a member of the medical unit here in Australia as one of the sexual and reproductive health medical advisors. Our role is predominantly to provide support to operations for the Paris group of MSF. This evening, I'm also joined by 2 amazing field workers. One is Anna Hashkovex and Shana Morris. Shana is a doctor and Anna is a logistician. Welcome to you both. Good evening.
Hi, Marg.
So we'll be hearing from Anna and Shana a little bit later. I think it would be very fair to say that 2020 has been a challenging year for everyone. In regards to global health, it has been extremely challenging. Now, COVID-19 has taken the limelight, and appropriately so, but we need to remember that there are still so many other health issues that affect so many people all around the globe. Things such as malaria, malnutrition, complications of childbirth, access to family planning, trauma of war. MSF has continued to provide care to over 470 projects in over 70 countries, supporting those most in need while also responding to COVID-19. We've had to respond quickly. We've had to navigate travel restrictions, limited PPE. We've had to establish new cold chain routes for supplies. We've adapted and we've ensured that we continue to provide quality care to patients and to communities. We've also managed to establish quite a few COVID-19 projects in places such as Brazil, Italy, Greece, and many other places across the world. Within this 2020 context, we thought you might be interested to see a snapshot of MSF Australia's recruitment for the year. We had 256 new applications, and of those, 86 progressed to interview. From January the 1st through to October 31st, we mobilised 92 placements. This compares to 147 for 2019, and you can see there has been a considerable decrease, and that has been due to COVID-19. Of the interviews completed, 33 people have been mobilised to the field, and the rest are waiting to be matched. If we look at our departures for this year, you can see that the majority of the mobilisations are filled by experienced field workers, with 59 people taking up another placement. The top 5 destinations in 2020 for Australian and New Zealand field workers was Afghanistan, Palestinian Territory, Yemen, Iraq and South Sudan. So we are still receiving applications from medical professionals, but most are actually stating that their availability is not until 2021. And this is because a lot of people are involved in the COVID-19 response here or in New Zealand. There are, however, certain profiles that we really do need urgently, and these include surgeons, anaesthetists, obstetrician and gynecologists, senior ICU doctors, ICU nurses, IPC nurses, and neonatal nurses. So if you fit any of these profiles and you are available now, please consider applying to us as soon as possible. There are other profiles, of course, that we do recruit for, but we are not actively recruiting for at this present moment, and that is registered nurses, registered general nurses, electricians and logisticians, unless those people are bilingual, speaking English and French. This slide here just shows you some key points regarding our recruitment process. But please feel free to check the website for further information and to see if you fit the particular skills that we need at this moment. So I am now going to, we're now going to be talking to Anna and Shanna about their field experiences. We will have time after that for some Q&A, so you can send your questions through as the session progresses. You can post them on our website, on YouTube or on Facebook. We will be answering general recruitment questions this evening, but unfortunately we won't have time to address any questions regarding individual suitability. I'm delighted to see that so many of you have joined us. So if we don't get to your questions live tonight, we will be responding in writing over the coming days. So thank you and welcome again, Anna and Shanna. So before we talk about your field experiences, I'm wondering if you could just give us an introduction to yourselves. Shanna, perhaps you could start first.
Yeah, hi Mark. Thanks for having us this evening. It's a pleasure to join. So I'm Shanna. I'm currently just finishing up my 5th postgraduate year and I'm completing my training as a rural generalist, currently based in Yarrawonga in Victoria. I returned from my first mission in July, where I spent 7 months in a project up in northern Iraq in the Sununi project. I was working there in a small rural hospital where we offered maternity, paediatric, emergency and mental health services. I was recruited to that project as one of 2 medical doctors with experience in both emergency and paediatrics to support these departments.
Great, thank you. And Anna, you're from a non-medical background, I believe?
Yeah, that's right, Marg. My professional experience before MSF was working in event management and venue management. I also have some experience sailing on ships. So I've been with MSF for 4 missions now. My first mission was in Uganda in the Bidi Bidi refugee camp, facilitating health services for South Sudanese refugees who had crossed the border. My second mission was close to home in Papua New Guinea. I was the outreach log and my job was to facilitate an outreach clinic for tuberculosis. We did this by helicopter and by boat and by foot. So a lot of the outback in that mission. Mission number 3 was in Iraq, just south of Mosul, so quite close to where you were, Shanna. I was working in a hospital there. We specialised in a burn unit. And mission number 4, where I've just returned from in August this year, was in the north of Yemen, where we managed 2 hospitals.
So, Shanna, this was, as you said, your first field placement. And, you know, I can recall back to my first field placement, and we know there's challenges always with that, and it's a new experience and you learn many things. So I'm wondering if you could just share with us how you found it, and also particularly, I suppose, during this time of the COVID pandemic.
Yeah, as you sort of say, Mark, the first missioner experience is always a really challenging experience and a really new experience. And certainly my path changed a lot in the course of the 7 months I was there. A lot changed and a lot happened. So I think really that first few months as a first missioner, you just spend time settling into your new role, working with new teams, understanding the project, the context, understanding MSF's organisational structure, in addition to practicing medicine in another setting and working within MSF guidelines. Then I think a couple of months into my mission, we had a bit of a change in our security context, whereby we evacuated 7 of our 11 expat field staff. So that sort of led to a bit of a transition, juggling multiple roles. And then sort of COVID rolled around about halfway through my mission. So a lot of our focus shift to setting up for and developing our emergency prep strategy. To that end, I was really grateful for having completed a bit of public health training before I actually went and worked in the field. Certainly MSF in our project was assumed to sort of take that lead role in terms of health partners in the area to coordinate the COVID response. So not only were we responsible for setting up our project, making sure our staff and our beneficiaries were protected, but we also did quite a bit of education and health promotion with other health partners, PHCCs and our hospital across the mountain, but also those non-health partners, the government, the police, the military, that all enable us to work in these contexts. Like so many other services, we were challenged by PPE shortages. But early especially, we had a lot of supply shortages in the field where international borders were closed. There were national border and checkpoint restrictions. So getting our supply and resources into the project meant we did have a few shortages that we were juggling with early. That, and certainly our staff shortages for those same reasons with border closures in country, a lot of our staff were stuck on other borders. So we were juggling many resource shortages.
That must have been really challenging. I could only imagine, you know, with staff shortages and equipment shortages, that must have been very difficult. I wonder if you could actually just tell us what you found, I guess, was the most, the biggest challenge professionally. Was there anything in particular, apart from what you've already mentioned?
Yes, so I think certainly professionally working within that public health sector and trying to put that hat on when predominantly I've been doing mostly clinical roles prior to, that was certainly one of the big challenges in the COVID response. I think juggling the multiple roles again through a few challenges there that, yeah, we're pushed in medicine at different times, but that was another element as well. And I think probably the biggest sort of professional challenge, and perhaps one of the hardest to accept, was the lack of access to sort of quality care and life-saving interventions that were imposed by COVID because of the border closures. We were no longer able to access Kurdistan, where a lot of our patients relied on those tertiary services that are not too dissimilar to what we're accustomed to in Australia. So that was one of the biggest things that was really, really difficult to accept, and how that changed over the three-month period.
So Anna, I imagine you've just recently come back from the field as well, so you would have been there during the time of COVID, but you've also had previous field experience outside of COVID. So I'm wondering if you can just share some of the experiences you've had, and I guess particularly this recent one through COVID, probably similar to, I guess, a little bit similar to what Shanna was just saying.
Yeah, I would mirror a lot of what Shanna was saying. My mission certainly looked different from the beginning to the end. The responsibilities changed, and we had to pivot to provide new care while sustaining the hospitals that we managed. So I was in North Yemen, as I mentioned. This is a Houthi-controlled area, which meant there was a lot of, there's an ongoing civil war and a lot of political instability. So this compounded with the pandemic and a lack of basic healthcare made it really difficult for us to respond how we would like to. So we weren't allowed to proceed with any public health messaging. There wasn't a national lockdown in place. There was a lot of things that weren't controlled outside of the healthcare setting that made it harder for us. As Shanna was saying, our borders were closed as well, so we couldn't get in specialists or teams, and we couldn't get in supplies. So it meant a lot of reflecting on what we had and what services we could provide. A lot of talking to the Ministry of Health and negotiating with them on who was going to be responsible for what part of our work. At the beginning of the pandemic in Yemen, there was only 200 tests for about 20 million people in the north. So this really impacted how we were going to strategize things like triage and isolation. We all took on additional roles because of the lockdown in the airport. We had to do 2 jobs, most of us, as with you as well, Shanna.
Mm-hmm.
So there was a lot of extra responsibility, and there was also really changing goalposts. You know, every day we would have new guidelines to use, new advice. So we just had to be patient and take all of the new advice every day and change how we reacted to this. We did manage to take over a local school in our area. We actually built a 16-bed treatment centre, which was used, but it wasn't very well accepted. There was some mistrust in the community about accessing the services that we provided.
And was that mistrust, was it just because people were afraid of COVID and coronavirus and what it was? The unknown, do you think?
Yeah, it was a range of things. Most worryingly, there was a rumour in the community that there was lethal injections given in the COVID centre, that if you came in, you might be killed in the night. There was also a general mistrust of foreigners. People thought that maybe we brought COVID with us, or that we were pretending COVID was real in order to receive funding. And I think some of these come, you know, with living in a civil war country. There's not a lot of trust for institutions, and certainly not for foreigners.
I guess it makes it hard when you can't actually go out into that community and do your community education as you often normally would, because of COVID as well.
Yeah, absolutely.
I think what you've both highlighted here is that you need to be very flexible, obviously. And also I think just it reminded me of a few of my missions when, we rely so much on the national staff, and we know that our national staff are amazing. I wonder if you both like to share your thoughts on that. Shanna, how did you find working with the national staff?
Yeah, absolutely, Mark. They really are. They're the backbone and the life of MSF projects, and they certainly are the majority of MSF staff. In the 7 months that I was working in Iraq, I've never met so many inspiring people in my life as I did in that project. And that's pretty incredible, because I'm fortunate that I'm in a field where we work with and meet pretty amazing people every other day. So really, they're the reason we're there. They're the reason that it makes the work so rewarding. And so satisfying.
And Anna, yourself, you've had experience, in a few missions now. How has that experience been for you working with the national staff?
Yeah, incredible. I think a lot of people don't realise that the national staff make up 90% of MSF's staffing across the world, and they're really the backbone to the mission. They are skilled, experienced individuals that we meet all over the world, and they come into work every day, even when they and their families are living through a civil war, a natural disaster. They often work harder than us. They look better than us when they're doing it. And they're absolutely the backbone of the care that we can provide all across the world.
Anna, you mentioned quite a few challenges you had, but was there any particular professional challenge that you want to share with us tonight?
Certainly for COVID treatment, our access to oxygen became really vital. And I think that this was mirrored in various projects across the world. We decided to not go ahead with intubation ventilation because we didn't have the capacity, we didn't have the tools, we didn't have the staff, we didn't have the training. So we decided that we would try and provide as many beds with oxygen as possible. But this became really difficult for us because we didn't have enough concentrators to produce oxygen. We organised oxygen delivery by road, but we were very wary that due to the pandemic that our supplies could be cut off at any time. So things like plastic sheeting, oxygen cleaning supplies became our bread and butter for a few weeks, gathering those, making assessments about how much of those we could use in line with the medical staff, the amount of nurses, and the space that we could physically use to set up a treatment centre all became really important.
I think it really emphasises to me that, we often, myself as a medical person, you think of the medical side of it, but it really shows that it's a team, isn't it? If the medical side can't function without, your logistics side, without administration, and vice versa. So it really, seems to me that teamwork is really important. Would you both agree with that?
Absolutely. Yeah.
So I think just talking about a team, I think the living conditions, that brings up to me the thoughts of the living conditions. We have to live with different people in the international team. And that can be exciting and also have its own challenges in a way. So, Shanna, I wonder if you could share with us, as your first field mission, how you found the day-to-day living, and I guess were there any adaptations you had to make because of COVID in that situation?
Yes, I guess, Mark, for us in our setting, we were almost a little bit fortunate in the sense that we had a bit of a change in our security context just leading up to COVID. So we were almost in our own little expat lockdown for the sort of 6 or 8 weeks before the national enforced lockdowns came into place. So it was a little bit of an easier transition, not having to then readjust again to that national lockdown. So yes, certainly we were spending most of our time hospital or guest house, and you were spending a lot of time with your expat colleagues, which really was a blessing in a lot of ways, because when you're working so hard and so continuous, they are your support and they do become that support around you. So certainly challenging, but a lot of benefits of having that support in the field. Yeah.
And Anna, how did you find it?
Yeah, look, certainly every mission is really different depending on where you are and what services you're providing. For instance, in my first mission in Uganda, we were shoved into a very small house with limited electricity, limited Wi-Fi, and this improved as we stayed. But when we started, there was certainly some cardboard walls in between rooms. My second mission in Papua New Guinea, we were in a beautiful beach house. You could swim after work every day, but I was also doing outreach, meaning I was camping for about 50% of that time between the house and camping on the river. In Iraq, it was a beautiful house with not a lot of chance to go out. So like you, Shana, we had high security rules, which means we were between the house and the hospital. Really, there wasn't a lot of walking around or weekends out. And certainly in Yemen, it was the same. We were locked down and didn't have much of a chance to get out. And COVID certainly restricted that further. It also impacted our ability to go on R&R. So we do try and get to R&R every 3 months or every 6 weeks, depending on your context. And this wasn't possible anymore because the airports were closed. So there was a lot of tired people working 2 jobs and responding to COVID at the same time. So it really did affect our movement. And yeah, we lived between the house and the hospital.
So how, if if that rest wasn't as easy as outside of COVID times and recreation, what kind of strategies did you use, I suppose, to help you stay sane or, to stay motivated?
Yeah, sometimes we took turns, it takes a bit of effort to organise something to give some relief, It does take a bit of effort to organise a dinner or movies, but that's what we did, We did what we could with our group. We did a lot of cooking. It didn't always turn out very well, but we did a lot of cooking together. We tried to do barbecues on the weekend. We played dominoes. So really trying to put in effort to spend quality time, not doing work things when we could.
And Shanna, any tips from you about, how to sort of stay sane in a crazy environment?
No, I just reiterate a lot of what Anna said. You use what's around you, you adapt. I think you sort of know yourself too, and how you can relax and unwind. So taking those skills to the field is always really valuable. And yeah, using what is your new family, which is both the expats that you're living with, but also the national staff that you're working with day to day. They become your biggest support.
Yeah, some people really enjoy exercise. In most houses, there's some form of gym or equipment. I personally got really into audiobooks during COVID. So really whatever works for you.
I remember I took a lot of photos from home. Did you do that as well? Yeah. It was really nice just to look through those photos at the end of the day sometimes.
Yeah.
Yeah. I just wonder, Anna, because we've spoken quite a bit about COVID and what it's been like in the field with COVID. Would you just like to share an experience from a previous mission, non-COVID, about how that was for you? Maybe just some of the challenges that were outside of COVID, just generally being in the field?
Yeah, sure. I could refer to my time in Papua New Guinea. In this mission, we were treating TB, which requires monthly checkup and quite a comprehensive regime of drugs that need to be taken. As I said, we did our outreach by helicopter and boat. So it took a lot of coordination, supporting the medical activities. And that's my job as a logistician, is to support the medical team in what they need. And if that's contracting and hiring ambulances, if that is building a hospital or building a new ward, if that is opening a new facility, anything that they need, we need to work on. So every country has its own challenges, really.
And you sound like you've had quite a variety of experiences, which must be quite nice, I think. And
absolutely.
You keep coming back.
I think I'll keep on coming back. I love it. I mean, in Iraq, in Kayera, which you would have heard of, Shana, while you were working across the mountain, you probably knew that we had a burn unit. So it's quite a specialised and high level of care in quite a remote place. We weren't in Mosul, we weren't in the capital. So everywhere you go, there's a medical need that we meet or we try to meet. And I find that really interesting.
And Shana, will you be coming back again? That was your first mission. Do you have any thoughts about going to the field again?
Yeah, absolutely, Mark. I probably can't get there soon enough. I think, unfortunately, a lot of doctors, we're a little bit tired sometimes with our training programs. So it'll be a little bit of time before I can get back into the field, but I'll be jumping at the opportunity.
I think this is probably just a good moment just to mention, like, particularly from my perspective as one of the medical advisors, that for medical people in the field, you mentioned that we have protocols and we do have specific guidelines that people can follow. So the experiences might be a little bit different to what you would have at home in a healthcare setting. Some of the diseases, for example, that you might manage. But we have some good, strong guidelines and protocols. Shana, you would have experienced that in the field, and you would have used those guidelines, I imagine.
Yeah, absolutely. I think medicine is the same anywhere in the world, but I think the context that you're practicing in and the guidelines that you are using to change just that little bit from setting to setting. And we even see that within Australia when you're working in different institutions, it's no different. But MSF it's an organisation that's been in the field for so long. They've got really nice developed evidence-based guidelines that we're using. And that's really a beautiful transition first mission, because you've got a lot of that support there, which is great. Yeah.
Fantastic. Well, we might actually jump to some questions, I think, now. So I'm going to be joined by Jodie Cornish. Jodie is from our Field Human Resources team, and she's here to answer any of the recruitment questions that we might have. So I'm just looking up there on the board. So we have a question from Suki from Facebook. Question for Jodie. In terms of doctors, are you looking only for fully qualified specialists, or are you also looking for applications from senior trainees?
Thanks, Margan. Hi, Anna and Shanna. Yes, we are looking for both specialists to work with MSF in a specialist position. You must be a fully qualified specialist, so not a trainee. You need to be a specialist, and otherwise we need a PYG3 to take up a generalist doctor position. So, for instance, a GP obstetrician cannot work as an O&G in the field. You must be a fully qualified specialist.
Mm-hmm. Thank you. Benjamin from YouTube has posted a question for you, Anna. How did you find this skill set transfer from working events to doing logistics on missions with MSF?
I actually find it transfers really well. The world's a stage. The skills that you find working in like larger venues or festivals transfer really well to a place like a refugee camp. So you have to manage multiple things at the same time, from security to egress and exits to the amount of water provided. It's really that multifaceted approach and the ability to respond and react really quickly that I think transitions quite well. Logistics within MSF, or logisticians, are a really broad range of people, from construction specialists to firefighters to hotel managers. It's really if you can show that your skill set will progress over. In my experience, I think I'm better at managing groups of people and managing projects, whereas some people that we have in the logistics team are electrical specialists, and they will fly in and they will set up the generator and all of the wiring that you need. So you're not expected to do everything, but if you're willing to do a little bit of everything and ask the right questions, I think that event management links really well to logistics.
Thank you. So we have another question from Laura from Facebook for Shanna. Laura's a doctor, Shanna, and she wants to know how to prepare to go to the field.
Yeah, so I guess it really depends where you are up to in your sort of MSF journey. I know it's a pretty, by the time you do your pre-departure training and your interviews to then preparing to going, and I think get as much information as you can about your project, about where you're going if you're already up to that level of placement. Speak to people who've been in the field in the past, who've been in that project in the past, if you're at that early thinking about applying to MSF stage and coming back, I think, to that first question that was asked from online, as a young and a more junior doctor, don't be off-put by being a junior doctor, but get your experience and your diversity. Have experience in different settings within Australia. Do some remote or rural work in Australia. The public health background is invaluable because a lot of your work, even pre-COVID, is looking at project targets and numbers and data and evaluating that. So the more experience you can get, I think the better prepared you're going to be. And I think coming back to that specialist, there's absolutely such a critical need for specialists in the field, but rural generalist fits in really nicely as well. I think in my time, I was the emergency doctor, the pediatric doctor, helping the maternity ward, mental health. So that rural generalist background also fits in really nicely.
And it's a good point you make, actually. Before I went to the field, I had some experience in rural Australia, remote Australia, and it really did, you could see the transferable skills there. Yeah. So we have another question for Jody from Celeste from the website. Could you tell me whether there is many open posts for epidemiologists currently?
Hi, Celeste. Yes, so it's not currently an urgent profile, but we do have a steady stream of epidemiologist placements, and we're always recruiting.
Another one for you, Jody, from Thomas. What is the training like prior to deployment? Shannon mentioned public health training before her mission. Was that very detailed or more scratching the surface?
So I think Shannon was referring to personal public health training.
Yeah, that was my personal training.
Yeah. MSF does provide training beforehand. We provide a 3-day face-to-face program where possible called Welcome Days, and alternatively at the moment that's online and about 2 days. But that pre-departure training's more around the security, looking at MSF as understanding and looking at MSF as an organisation, as well as cross-cultural competencies and working together as a team. And team management. There's a whole lot of things that pre-departure training covers, but it's not professional training, and you can access some of that in the field, but ultimately you need to access and already have those skills to take with you.
Another question for you, Jody, from Humara. How fluent speaking do you need to be in French or Arabic? So
you need to be fluent in French. A fluent French speaker to be considered for a French-speaking mission. Otherwise, most Australians and New Zealanders are sent to English-speaking missions. And when I say fluent, that will need to be certified, and we do test that if required. And Arabic also, whilst that doesn't, you're not tested necessarily, you would need to be fluent as well.
Great, thank you. So, unfortunately, that's all the time we have tonight for questions. But as I mentioned, if we didn't get to answer yours, then we will do so in writing over the next coming days. So I'd like to take this opportunity to thank Anna and Shanna for speaking with us tonight. It's been really, really amazing to hear from you and hear of your experiences. So thank you both very much.
Thanks,
And I'd like to thank all of you who joined us as well. I'm sure you've been inspired by what you've heard tonight. If you would like any more information about recruitment, you can go to our website, and on the website we include some frequently asked questions. There will be information about the recruitment process, about terms and conditions, and many other things, and they're all detailed on the website. So thank you all again for joining us. It's been a pleasure being here tonight as well, and please take care and stay safe. Goodbye.